Narok County is home to the Maasai people, a conservative community that has remained mum on mother's sexuality. Now women leaders are on the forefront in speaking for the girl child after the community was ranked top in teenage pregnancies in a report released recently. While urging the Ma community to embrace open dialogue to curb teenage pregnancies, women leaders called on the Education Ministry to ensure age-appropriate comprehensive sexuality education is implemented in all schools.
Sex education is very paramount. I know within our culture, some of these topics are taboo, and I think that's where the problem begins. Because if I give an example of the Ma community, it is very rare to find these days a mother and a girl sitting together and talking openly about sex. And I think the more we keep burying our heads in the sand, the more these problems keep going on.
Sex education was there in the villages. I do not think it is something to shy away from. It should be brought into the education system.
According to statistics released by the Population Council, Narok County leads at 40% against a national prevalence of about 18%. The leaders are against the provision of contraceptives to sexually active school-going children.
I wouldn't advocate for our girls, underage children or young girls or boys, for that matter, to do family planning. I think we are going the wrong way if we do that. The thing to do is go back to the basics of our values and morals.
The latest survey also places Narok County top in early marriages, women illiteracy levels, and low uptake of family planning usage. USAID Senior Health Advisor Dr. Sheila Masharia urged the women leaders to champion for the rights of the girls by speaking against the barbaric cultural practices.
That we must address the barriers that prevent girls from getting ahead, that prevent girls from getting education. And this includes getting married too early and some of the cultural practices that place barriers. We recognize that one of the things that must be addressed is that from a very early age, boys must be included in the conversations that talk about prevention of pregnancy, so that they see themselves as an equal partner in prevention.